We're going to go ahead and get started here. So if you could grab your seat, and we've got a bunch of folks joining us online as well. So feel free to come on in and grab your seat. We'll get going. My name is Jens Odegaard. I'm the Director of Marketing here at the Carlson College of Veterinary Medicine. Thank you all for coming tonight, both in person and online. We have animal lovers from all over the country joining us, so that's cool, via Zoom. And thank you for being out here on a beautiful fall evening here in Corvallis. At the Carlson College of Veterinary Medicine, our mission is to advance the health of animals, people, and the environment through inclusive and equitable education, research, and services to the public. We have 326 students, 309 are studying to become doctors of veterinary medicine, and 17 are graduate students in our comparative health sciences program. The college serves the public with research and direct clinical and diagnostic services through the Lois Bates Atchison Veterinary Teaching Hospital and the Oregon Veterinary Diagnostic Laboratory. A few housekeeping notes for today's presentation. For those of you online, we'll get the chat function fixed here in a second, but you can drop your questions in the Q&A and we'll get to them at the end of the presentation. And in person, please hold your questions till the end of the talk, and we'll reserve time for that at the end. So I'd now like to turn it over to today's presenters, Dr. Stacy Semevolos and Dr. Katja Zellmer.
All right. Welcome, everybody. Glad to see you all here, both virtually and in person. It's always interesting doing these hybrid events, so we're really excited to talk about sports injuries in horses and how to triage those as horse owners. This talk will go over recognizing injuries, how to recognize an injury in your horse, and then how to respond to these types of injuries. We see a lot of injuries, including tendon, joint, and bone injuries, and that's what we'll be focusing on tonight's lecture. Maybe? You want me to advance? Doesn't like either one. Okay, so who are we? I'm Dr. Semevolos. I grew up in Illinois and actually went through the pony club ranks once upon a time, all the way to A rating. And I did a little bit of eventing when I was in high school. I did some dressage, jumping, hunter jumper. In college, I played polo. And then I got serious about my studies and went to vet school at University of Illinois. And later, completed my surgery residency in large animal surgery at Cornell University. I've been at Oregon State since 2002 and am currently board certified in large animal surgery and also in veterinary sports medicine and rehabilitation in equine. I've also completed a program at University of Tennessee, which has certified as an equine rehabilitation practitioner. And these are a few of the big horses that we have now. My husband competes in draft horse pulling competitions, and then that's an old picture of me in high school.
And my name is Dr. Zellmer. Let's not worry about the Duesterdieck. It's too difficult. I was born and grew up in Germany, where I guess, hassled my mom enough to eventually allow me to start vaulting, equestrian vaulting. And then, of course, that was a pathway to doing some other riding, dressage, and show jumping. And on the lower left there, riding on the beach that was just 5-minute walk from us. I went to the veterinary university in Hanover in Germany for my veterinary degree. And then I was able to start as a visiting research scholar at Michigan State University in the performance lab, and got into an internship and then a surgery residency at Virginia Tech in Blacksburg. And then I still did not have enough of university education in my mind and decided to do a PhD at Colorado State University in the orthopedic research lab before I started here in 2006. I also am board certified as a veterinary surgeon. and in veterinary sports medicine and rehabilitation for equines. And I also took the course to become a certified equine rehabilitation practitioner at the University of Tennessee. So our paths kind of collided there a little bit. And yeah, thanks for coming to everyone.
All right, so we're going to kind of divvy up today's talk. I'm going to start, and then Dr. Zellmer will join in, and then I'll finish up at the end. So first of all, let's talk about what some of the common sports injuries that we see in our equine patients and our horses. Tendons and ligaments get strained, gets ruptured. Maybe you've known somebody that's had a horse with a bowed tendon. We'll talk about how to recognize that and then what to do if you do have a horse that has that problem. Joints can have all sorts of problems. They can have fractures. This is an example of a CT image where this horse had a comminuted, which means many fragments. So this one had a pretty severe injury to the knee joint or carpus, which resulted in multiple fractures through one of the bones in the joint. But other injuries can happen to joints, can involve the soft tissues, the capsule around the joint, or the ligaments within the joint itself. We can also have bone and fragments of cartilage that we need to go in and take out surgically. And then bone is the kind of the last category that we're going to be talking about with sports injuries. And that can be something really catastrophic like a fracture, or it could be less catastrophic where you might see a lameness and maybe a bone bruise that would show up on an MRI, but doesn't show up on some of the x-rays that we take. So we're going to pause and just poll the audience, both here and online. What sports injuries has your horse experienced? And you can obviously select more than one. So we'll just, I guess for the audience that's here, how many have had horses that have had a tendon injury? Quite a few, maybe about half or a third. How about joint injuries? Not quite as many, but still a few. Bone injuries? Okay, getting some of the other audience members. And then how about other types of sport-related injuries not included in any of these categories? Okay, how about never had an injury? All right, you're lucky. Seems like most horses will have an injury at some point in their life if you own them long enough. Yeah, so let's see what our poll in the online sector says.
65% were tendon injury, 27% joint, 16 bone, 22% other, and 18% never.
Oh,
Okay, so mostly tendon injuries, and that seemed to follow what you all have seen as well. So great. We'll advance here. So how do we recognize sports injuries? There's 4 basic things. Pretty straightforward, but sometimes it's hard to recognize when it's subtle. Lameness is one. If your horse is limping, is off, any of these sorts of things, that certainly is sort of a cardinal sign that something's wrong. It can be many different types of injuries. Some might be what we wouldn't necessarily consider sports related, but some will fall in these categories that we're talking about tonight. Swelling is another cardinal sign of a sports related injury. It can be swelling of the joint, can be swelling around the joint, can be swelling of the limb. So there's kind of generalized swelling, and then there's more focal swelling that can specify or allow us to determine what particular area is the problem. Heat is another cardinal sign, so it might be hard to feel a difference, particularly if the horse has a long hair coat. You might not be able to tell subtle differences in skin temperature, but when there's inflammation, generally there'll be a little bit of heat that will be generated at the skin surface if the joint is near the skin surface. Sensitivity to pressure is something that we'll often see in some of the horses that we have sports-related injuries in. So these 4 things, sometimes you'll have one of them, sometimes you'll have all 4 of them at the same time, and sometimes maybe you won't notice any of them, or somebody else might notice one of them in your horse. So let's start with tendon injuries. heat and swelling in the tendon area. Maybe you've seen a horse that looked like the one on the right-hand picture here. If you look at the back of the flexor tendon, it bows out a little bit. This is sort of the classic bowed tendon that we see when we're involving the outermost tendon called the superficial digital flexor tendon. That doesn't mean that that's the only tendon affected, so we'd have to do more investigation to know what all was involved with that particular injury. But this is more of a horse that's had this probably going on for quite some time. When you see a horse that's just injured their tendon, sometimes you'll just have a little sensitivity. If you squeeze over the area, there might be some heat and maybe just a little bit of swelling that's very subtle and hard to detect, but you can with palpation feel it. I always tell our students that we want to palpate tendons both off the ground, unweighted, as we see in the left-hand picture, and then also when they're standing. And that's helps us to differentiate, feel each tendon individually, feel for swelling, feel for subtle changes in heat and sensitivity. So those are really the kind of basic things that we'll be looking for when we're looking for tendon injuries, particularly a bowed tendon or one that has a strain where there's tearing of the ligament fibers. There's the arrows pointing again at the bowed tendon, which is more classic and sometimes a longer standing injury. This is another example of a tendon injury that's involving the actual sheath around the tendon, which is running along the back of the fetlock joint. This is called the flexor tendon sheath. And you can see there's quite a bit of swelling and this is fluid filled. And this can be because there's a tendon injury within that sheath. Can also be injury to the structure that produces the synovial fluid around the tendon. Or the annular ligament, which runs as a band across the back of the fetlock. So there can be a few things if you see a horse with this type of swelling, that might not just be a tendon, but it might be more than one thing that's involved. So as a veterinarian, we'd be coming in and trying to ultrasound that and determining what all is the problem. Okay, so how about joint injuries? Again, looking for swelling, looking for heat, looking for sensitivity, looking for pain. If you lift the horse's leg up, let's say to pick it out and they're ouchy because you flex one of their joints that has swelling, that can be a sign of a joint injury. There's two examples on this particular slide. The one on the left-hand side with the gray horse, that has more of a generalized swelling around the hock. And that might not just involve the joint itself, but might involve some other soft tissue structures, ligaments, capsule, multiple areas. Maybe there is a more severe sprain of the whole hock area. In the right-hand picture, that's more focal, what we call joint swelling. Some people might call it bog spasm, where there's extra fluid in the hock, and we can just see that if you push on it, it's soft, and the fluid pushes around to the other side of the joint. So this might be more classic with a joint that might have a bone or cartilage fragment in it. Not a very severe injury, whereas this one might indicate there's more going on. Maybe there were more tissue that was torn. Okay, so joint injuries, and then finally bone injuries. How do we detect a bone injury? If it's a fracture, really catastrophic fracture, that will be pretty obvious. But many cases of bone injury won't show an obvious swelling. Might not know exactly where the problem is. So you might have to detect subtle heat or sensitivity changes. You might just see that your horse is lame or a little bit off, and maybe you don't know exactly where it's coming from. So we might be having to track down where in the bone that's a problem. Sometimes there might be a little bump, but other times it can be, particularly a stress fracture that's just happened, might not show much at all from the outside. Okay. So let's poll you again. What injuries require immediate attention by a veterinarian? Bowed tendon, bone fragment in the joint, bone fracture, or laceration of the flexor tendons. It looks like we've got our box is kind of in the way. I'll move that over. Okay, we'll let our online audience answer, and you can answer as many as you think are correct. Can be more than one answer correct. So how many think with a bowed tendon we need immediate veterinarian attention? Same day. Have a couple raising their hands. How about bone fragment in the joint? A few more. About bone fracture. Okay. Majority are raising their hands. Laceration of flexor tendons. Okay, more hands being raised. How about the online audience?
All pretty much right along with that, yeah, about 21% on bone tendon, 50% on bone fragments, 80 on bone fracture, 82 on laceration.
Okay, so in pretty good agreement here. I would, I guess, say that bone fracture and laceration of flexor tendons would be ones that I would say need immediate veterinary attention. The others might be able to wait a day or two, so doesn't necessarily have to be seen today, but should be seen within the near future. And we'll talk a little bit more about some other injuries. So which injuries require immediate vet attention? Again, fractures, breakdown injuries of the fetlock, such as suspensory apparatus, or if the fetlock's on the ground, that would be a bad sign. Lacerations or wounds that involve the tendons or looks like it cut through the tendons would be something that we'd need to immediately get a vet out, look at. And then lacerations or wounds that go directly into the joint. So sometimes it looks like a fairly simple or small wound, but it might be leaking some yellow synovial fluid, and that's actually something that needs immediate vet attention as well, because that can turn into a life-threatening problem with infection in the joint. So what to do immediately? Well, call your veterinarian. That's the first thing to do with this list of injuries, and stay calm. As calm as you can under the situation. If your horse is stable or the limb is stable enough to get them to a quiet stall, that would be preferable. If there's bleeding, such from a wound and through an artery or something like that, or a vein, then trying to put pressure on that would be important, usually by application of some sort of bandage over the area, as clean a bandage as you can acquire in the circumstances. If the limb is unstable, such as with a fracture, then again, bandaging might be indicated, or at least, again, keeping the horse as quiet as possible so they're not further damaging the limb before a veterinarian can stabilize it with a proper splint. We usually recommend avoiding touching the wounds with bare hands, just because any bacteria that are on our surface, such as staph, can infect a wound. So we try to avoid touching that, at least in the early time period when we have a wound over that area. We'll wear clean nitrile or latex gloves when handling the injury. Okay, so what about the injuries that don't require immediate attention but require non-emergency vet attention? So those would be more injuries where it's the limb is stable. So a bowed tendon falls under this category. Usually there's torn fibers, but it's not completely ruptured. If there's a bone fragment in the joint, at least a simple bone fragment might not be something that has to be attended to same day, but can at least wait for your vet to come out within a few days or weeks time. Bone bruises, again, might not be diagnosed without something like an MRI, so you probably might have to wait to know if that's a diagnosis or not. And then if there is joint swelling, but the joint does not seem unstable, that again would be something to have your vet out within a few days, but that wouldn't require immediate attention. So what initial treatment do we recommend for non-emergent injuries? And I'll start this, and then Dr. Zellmer will kind of carry it through. But usually until your vet can come out and make a diagnosis, it's probably important to keep your horse in a stall just so they don't injure themselves further. So if they have a partial tear of a tendon or a ligament, if they're out in a pasture or paddock, horses are silly, they run around and don't protect themselves. So that's bad for those types of injuries. It makes a bad injury worse. So at least stall confinement until a vet can make a proper diagnosis and tell you what you have. Cold therapy is often indicated for acute or early injuries for decreasing heat and swelling. This could be from 15 to 20 minutes a day, twice a day. And Dr. Zellmer will talk about how you might institute or what types of cold therapy we might try. Usually cold hosing is very easily available, but there's lots of other systems also available that you might have available to you. Bandaging may be a way to help reduce the swelling in the area, particularly if there's generalized swelling. And then medications such as phenylbutazone might be given as an anti-inflammatory to decrease that early inflammation post-injury. And then your veterinarian will, once you have a diagnosis, your vet will be prescribing either medical therapies, possibly a surgical therapy, or rehabilitation. And sometimes all three of those can be part of the treatment plan and the rehabilitation plan. So I'll turn the mic over to Dr. Zellmer, and she'll talk more about cold therapy.
All right. So how can we cool mostly horses' limbs down effectively? Probably the most readily available is cold hosing. It's probably also the way that is least effective in really cooling down tissues compared to other ways to do that. If you think about that horse there standing in that ice water bucket, makes sense that that is a little bit more effective. Might not always be as easy as this picture suggests, depending on the horse. But so it might be a good thing to try to get your horse used to standing in some water. That might then again be different if it's really, really cold. But you can also apply ice with some boots, like the ones kind of in the middle here, where you can stuff ice into little pockets. Even these are not that horribly effective in really cooling down tissues in our experience. And then there are some commercial cooling units. This is what's called the Game Ready unit. None of us have stock in that company, but it works really, really well. It also can apply dynamic pressure to the limb, which has been shown to be superior, for example, post-operatively, also in humans, in decreasing inflammation compared to just cooling the limb or just putting pressure onto the area that the surgery was in or the injury is in. But of course, that unit is a little bit more expensive than a water hose. So let's poll the audience and let's figure out how long are we supposed to, at minimum, apply cold therapy for it to be effective. So maybe if you feel comfortable showing your hand, how about just 1 minute minimum? How about 5 minutes minimum? And then we go up to 10 minutes minimum. And how about 15 minutes minimum? And the last one is who knows, or maybe there's no consensus. And how about online, Jens? What kind of polling data do we have there?
No one thought 1 minute or 5 minutes.
Okay.
4% about 10 minutes, 69% 15 minutes, and 5% research findings.
Yep. Excellent. Yeah. So in general, we recommend 10 minutes minimum. And we already had a little bit of a hint in Dr. Semevolos' slide for 15 to 20 minutes. But when I actually tried for this talk to find some good primary studies, we really have no data in horses as to what timeframes are really effective. And even when I looked into the human literature, there is a lot of disagreement, and it probably also depends on what kind of cooling mechanism you're using. And for example, the ice baths in humans are used about 5 minutes typically, and sometimes 5 minutes twice with a 2-minute break in between. And that is effective in humans. Maybe we can't really use the data from humans to horses. At least horses can easily stand barefooted in snow, whereas that's not that easy for us to do. So there are definitely some differences. So what are we actually going for in our cold therapy? What we really want to attain is to get some anti-inflammatory effects. And I don't know if you've ever had a mosquito bite and you put an ice pack on it, it's at least for me, it's amazing how well we can decrease the inflammation from that. And that is very similar with injuries. But applying especially ice can also have negative effects, specifically can cause frostbites. That's probably more likely to happen in a person than in a horse, because the horse typically has some fur over the skin that insulates the skin, but we typically want to have some sort of insulating layer between the ice and the actual skin. So if you have a horse that has a completely clipped leg, maybe the ice bucket water bath is not the best strategy there. So in that case, you would want to check the skin frequently. And if you see that the skin starts to appear blanched, even with pigment on the skin, you should be able to see that. That would be a bad sign. Reddened skin is okay. And it typically, that typically happens, especially once you take, for example, your hand out of an ice bath. Then we don't want to use cold therapy over open wounds or over necrotic tissue. That means dead tissue. So if you have, for example, a piece of skin that is a little leathery, that is not a good area to use cold therapy on because it may decrease blood flow even further. And with dead tissue, that might not be the best strategy there. And there's some newer data in humans that would suggest that for just pure muscle recovery, so this is not for an injury, but for muscle recovery, cold therapy is actually not the best, and it actually slows down muscle recovery. So those ice baths that you sometimes see maybe in the news where people after running a marathon put themselves into it, that actually may slow down recovery from that marathon for them. So after you cool down the area, you may want to apply some pressure and to decrease swelling further. So let's put a bandage onto that horse's limb. What can we use for that? Most of us probably have some reusable materials, or if you don't, you may want to think about just buying some to have them ready for hopefully not a very frequent bad case scenario. But what we recommend are some quilts, and you can see them on the picture here, and polo wraps. And certainly there are also commercial bandages that may work better or less well than the good old tried quilts and polos. Here in the clinic, we do use typically one-time use materials, unless there are some financial concerns, because these are, of course, a little bit more expensive to use, especially if you have to use them multiple days in a row. And what we do use is this sheet cotton that you can see here, or roll cotton that you can see here, and then something that's called combine, which is a little bit like a diaper pad that can replace the quilts. And then we usually use some sort of conforming gauze or vet wrap or Coflex. Those are the most commonly used products to compress, basically to replace the polo wraps. You can also use Elasticon. That's quite an expensive product. For example, that 4-inch roll on the far right side is oftentimes easily $20 a roll, and that gets really expensive. But it provides a lot of compression. So for example, I use these for my bandages after surgeries when I say I really want that bandage to survive the recovery from general anesthesia in my patient. So let's do another poll question, and this one might be a little bit more controversial. So is it true that there is a right and a wrong direction to wrap a bandage on a horse's leg? And let me maybe minimize this one. So how about, and you don't have to sign your hand if you don't feel comfortable on this one. So option A, yes, always pull the wrap towards you over the front of the leg, like you see in the upper picture. The next one is, yes, always pull the wrap towards you on the back of the leg. Or we have the option C, no, either direction is fine as long as all layers are wrapped in the same direction. Yes, well, let's see online. What?
52% say A,
Mm-hmm.
15% say B,
Mm-hmm.
and 33% say C.
Excellent. So either, at least in my opinion and experience, either direction is fine as long as all layers are wrapped in the same direction, as long as we have an adequate amount of padding underneath our layer that we use for compression. I sometimes say in Germany, we don't have pony club, where I think most commonly it is taught that we should always pull the wrap towards us over the front of the leg. And we don't have more bandage bows or bow tendons due to wrong bandaging than here in the US. And that's where I derive my opinion from, that it shouldn't really matter, again, as long as we have appropriate padding underneath. So some other rules of thumb, I already mentioned the appropriate padding. Then we also want to try to avoid folds in our, especially in the padding and especially over the flexor tendons, because if we have a significant fold in that area, even with pulling the bandage towards you over the front of the limb, you will probably get some irritation and get a sore area or a swollen area on the back of the limb. And then tightness of the bandage, some people say don't pull bandages really tight. Again, in our opinion, or in my opinion, as long as you have an appropriate layer of padding underneath, you can pull the bandages as tight as you can, because typically none of the materials other than the elasticon, so the gauze or the vet wrap or Coflex, are actually strong enough to make it too tight. They will rip before you get it too strong. Again, as long as you have enough padding underneath. And that having the bandage really tight will also prevent the bandage from slipping. So that goes along with each other. And then how often should you reset a bandage? It depends a little bit on the situation, but if you have an acute injury, you probably would want to, if your vet is not coming out right away, want to check on that once a day. But in general, I recommend to reset bandages every 1 to 3, maybe 4 days. And especially if you're just starting out with bandaging, maybe it would be good to reset it more often than less often, in case you had a fold somewhere, so that fold is not sitting on the flexor tendon for 4 days. So to place your bandage on the limb, gather your materials, and I illustrated here in the picture what we're going to use in the video that I'm going to show you here shortly. The only 2 things that I didn't put on there were a pair of bandage scissors, and I also have a little scalpel blade. You can also just use a fairly sharp knife, and I'll show you what to use that for later on. Then have your horse restrained by a reliable person, and then you can go ahead and start with the bandaging. And let me pull up the video here. So in this video, I'm going to demonstrate to you how to place a stacked or a full limb bandage onto a horse's limb. I start with rolling the sheet cotton onto the limb, trying to avoid folds in the very first layer. I place the sheet cotton as low as possible onto the limb, making sure the coronary band is completely covered, especially in the hair area of the heel bulbs. Then I'm securing the sheet cotton with a conforming gauze, in this case, the 6-inch brown gauze. I don't pull the gauze tight for the first layer, but to secure it onto the limb, and then I pull it moderately tight for the first layer. I also, and I'm sorry, I'm going to pause that for a sec. I'm going a little slower than in my practice run. I also make sure that about 1/2 inch of padding extends beyond the brown gauze on the top and on the bottom of the bandage to avoid placing the brown gauze directly onto the skin where it would compromise blood flow. And then I pull the brown gauze as tight as I can for the second layer, going up the limb again. So then I continue with the sheet cotton on the upper limb. And you can see that I overlap that with the lower sheet cotton. And it is a little bit difficult with a larger circumference higher up on the limb to avoid folds, as you can see. I then secure the sheet cotton in similar fashion as before, using the conforming gauze. And this time, however, I make sure to go beyond the bottom of the sheet cotton with the brown gauze, which will prevent slippage of the top sheet cotton down the limb. Again, I pull the brown gauze moderately tight for the first layer, and I make sure to leave some padding peeking out from underneath the brown gauze at the top of the bandage. And then for the final layer, I pull the gauze as tight as I can to provide compression. Now I'm placing the vet wrap or the Coflex over top of the conforming gauze, starting at the bottom. And similar to the brown gauze, I don't pull it tight for the first turn around the limb, and I leave some of the padding peeking out at the bottom. And once it is secured onto the limb, however, I pull it as tight as possible without ripping it. You should not be able to see any of the little wrinkles that you can see on the roll of this product once it is wrapped over the padded bandage. And oftentimes I need a second roll to finish the bandage, and I make sure I overlap with the first roll. Again, at the top, I make sure to have some padding extending beyond where I place the vet wrap or Coflex tightly over the bandage. And then finally, I use some 3-inch elasticon to seal the top of the bandage so no shavings or other dirt can get in. And you can see how I relax the product before placing it onto the skin, because it will cut off blood supply if placed onto the skin too tightly. That would then damage the skin and the leg underneath. I guess we're not that far yet. So here's where the scissors come in very handy. Everything else you could rip. The elasticon is really, really, really difficult to rip just with your fingers. And I then also seal the bottom of the bandage with elasticon. And here it is especially important to not stretch it out too much, because if it cuts off blood supply to the foot, there's a real risk for damage to the hoof's lamina, which can cause severe lameness. And you can keep the elasticon from peeling off again by tucking in the end. So finally, we want to decrease the pressure the bandage exerts onto the back of the carpus or foreknee, where what we call the accessory carpal bone sits. You can look to the opposite leg and palpate for a hard spot through the bandage, and then make a vertical cut through the area, through the vet wrap and brown gauze over the hard spot for about an inch or inch and a half, so that it starts to gape. And I had hoped it would stop at the very end so you could see the gaping a little bit better. Huh. It did cut that off, so I apologize. So you will start seeing that gape basically, and you start to see the white cotton underneath. So then I thought I'd just very briefly talk to you about what you can expect once your vet actually comes out and helps you figure out what's going on with that injury. So for tendon and ligament injuries, what the most common diagnostic is that we use is diagnostic ultrasound. And on these two pictures, you do see the flexor tendons or flexor tendon. This is the deep digital flexor tendon in the area of the pastern. And this area, this structure here is actually called the straight sesamoidean ligament. And this horse has a core lesion within the straight sesamoidean ligament. It also has actually a tear of what we call the manica flexoria. We won't go into that too much, but on the orthogonal view, so the view that we take 90 degrees to this view here, we can actually see the straight sesamoidean ligament here. And what you can see here is that it bulges. It basically gets thicker and then a little bit thinner, and that is definitely also abnormal. So this just shows how ultrasound is very nice for us to diagnose tendon and ligament issues, and it is fairly readily available. Most equine vets do have an ultrasound. Most equine vets feel fairly comfortable with using the ultrasound for diagnosing tendon and ligament issues, and it is such also reasonably economical for you as an owner to be used. Sometimes we do have areas that we can't ultrasound. For example, the insertion of the deep digital flexor tendon within the hoof capsule, that's very difficult to do. And then we recommend performing a CT or computed tomography scan, or possibly an MRI, but those are a little bit more expensive to do, and typically you need to go to a referral institution for those. Once your vet diagnoses a tendon or ligament injury, typically these are managed or treated with stall rest, including an incremental exercise program to gradually strengthen that injured tendon or ligament. We can also perform intralesional injections, which means that we could inject a therapeutic into the core lesion, or sometimes we call it the hole in that tendon. For example, platelet-rich plasma, but there are also other therapeutics that we can use. And sometimes your vet may want to use shockwave therapy to improve healing, and or laser therapy, although at least with the laser therapy, the evidence of its effectiveness is not that great. Doesn't mean that it doesn't work on some horses. And then I wanted to just mention something to you with respect to differences in prognosis if we have an extensor or a flexor tendon that is injured. Typically, a flexor tendon injury is fairly serious and takes a long time and a lot of patience and work to rehab back to soundness. The extensor tendon injuries, as long as they're in the area of the cannon bone and not directly over the fetlock, are much less serious. Certainly, they also take a little time to heal, but horses typically go back to regular work with a very high success rate in those. Then for joint injuries as well as bone injuries, you will see that the list of diagnostics is identical. Typically, we start out with radiographs. And in this radiograph of a fetlock of a horse here, you can see this horse has a fracture right here in the what we call the proximal sesamoid bone. And radiographs are very good at detecting these. Not always immediately after it happens. Sometimes we don't see some fractures up to 2 weeks after they happened. We can also sometimes see fractures with diagnostic ultrasound. Typically, that's used in areas where radiographs are just not feasible, for example, in the hip or femur, although we have gotten better at radiographing those areas. And then certainly in some more complicated fractures, we recommend CT imaging, or if we do suspect a bone bruise, then we might recommend an MRI because it's not that easily detectable with other diagnostics. So for joint injuries that are diagnosed there, we typically have surgical options for example, removing fragments. Sometimes we also recommend arthroscopy to then diagnose soft tissue injuries in the joint. If we are fairly certain that there is no need to do surgery, then we commonly, with a joint injury, would consider injecting therapeutics into the joint, such as corticosteroids or hyaluronic acid or others. Then for fractures, your vet, probably in conjunction with a referral clinic, may decide that a fracture would need stabilization or could be managed via conservative management, meaning mostly stall rest and time. And bone bruises are typically managed conservatively. There's typically not a surgical option for us to augment healing with that. And then on top of these therapeutics, we now are using rehabilitation of sport injuries much more frequently than we used to. Basically, these are strategies derived from human physical therapy. The goals for these rehabilitation strategies are to decrease pain, to improve healing, and to allow the horse to maintain some muscle strength while they are laid up, so that maybe then they have a little bit easier time going back, hopefully after they've healed that injury. Then we also can support what would be called healthy movement patterns. So hopefully movement patterns that don't promote future injuries. And in some horses, we may have to return them to more healthy movement patterns. So there we would have to retrain muscle groups and return them to more healthy movement patterns. So what do we have available there? We have available manual therapies, such as different types of massage techniques. We can do stretches, such as carrot stretches, therapeutic exercises. You may have heard of, like when you scratch your horse's belly, they typically tuck up their belly and engage their core muscles. That's, for example, one of those exercises, and there are many. And then we have physical modalities such as cold therapy, therapeutic ultrasound, shockwave therapy, laser therapy. There are several different types of electrotherapies. And then even saltwater therapy, like a saltwater spa or an underwater treadmill that can be utilized. And then I'll turn it back over to Dr. Semevolos for the last few slides.
All right. So now we've talked about when your horse has an injury. As you probably heard, prevention is worth a pound of cure, and that's true in the horse world as well. We know that fatigue, or when a horse is tired at the end of a competition, that's when most of these injuries will happen. That's when they lose control, muscle control, neuromuscular control of their limb, and may overstretch or hyperextend joints and ligaments and tendons. So kind of thinking about how can we prevent injuries, proper conditioning is one of the keys to avoiding injuries. And when we think about the cardiovascular system, so heart and lungs actually adapt pretty fast within several weeks, so you can get adaptation to exercise. But when we think about muscles, they take a little bit longer. And then we talk about tendons and ligaments, joints, bones, those take a lot longer. So those take more like months, even 6 months to a year, particularly if we have an injured area that we're trying to get back, and then to prevent re-injury. So depending on, we want to think about the whole horse when we're conditioning them, not just the cardiovascular system, which is probably the easiest, because once if their heart rate and respiration come down quickly, we think they're fit, but that doesn't take into account all of the systems, including the tendons and ligaments and joints and bones. And so just some basics for conditioning, and it really is kind of sport specific, but some basics are regular exercise. So it's preferred to do daily exercise, or at least 5 out of 7 days, rather than sporadic or intermittent exercise. Each day of exercise should include a warm-up period and hopefully a cool-down period as well. Warm-up is important for muscles to warm up before they're asked to do more strenuous work. It's also important to warm up before doing any of the stretching exercises. So we don't want to stretch a cold muscle. We can either heat it up by applying some sort of heat compress or therapeutic ultrasound for horses that can't exercise by walking or trotting. But for other horses that are not injured, you can warm them up by a fast walk for 10 to 15 minutes, and then do some of the stretches that you might learn about, as one of them is shown in this particular picture. Suppling exercises, ridden exercises are very commonly done, again, to try to increase flexibility and also neuromuscular control of the horses. And these can be serpentines, circles, shoulder in. There's various suppling exercises to help your horse's flexibility. Competition specific exercise is going to be important as part of your conditioning for whatever activity you're asking your horse to do. The horse has to see the activity in order for their bones and tendons and ligaments to adapt to it. So that's one of the basic laws that we teach all our vet students, which is called Wolff's Law. For connective tissue, it will remodel depending on what forces are placed on it. So we need to at least allow in doses, increasing doses of activity to get in proper condition before doing a sporting event. And then finally, there's more of the, again, cardiovascular and other system, which can be conditioned through interval training or through other competition specific conditioning. And then there's also this notion that cross training in different events. So even if you have a horse that maybe does a lot of jumping, doing dressage, or doing, activities out on the trail, all of these sorts of things can actually help them and improve their performance overall and condition all of the systems together. So that's kind of a brief rundown of some of the basics for prevention of injury. And since we're kind of at the end of our time, we want to allow enough time for some questions. So we'll start taking those now. It looks like there's lots of questions on the chat, but we'll take some live questions. Dr. Kutzler? No, I think scintigraphy, so bone scans are very sensitive, and particularly for early bone injury, particularly in young horses such as race horses, can detect stress fractures and other early injuries. We just didn't include that on our common list of diagnostics, but it's still done. in this setting. Question in the back.
You were talking about the warm-up along the cool down. Do you recommend adjusting warm-up intensity based on both age and prior injuries to the horse, especially old muscle injuries and stuff?
Yeah, I guess I'd say the question for those online is,
Can you repeat?
do we adjust the warm up depending on age and maybe if they have had an injury, maybe the time or the types? I would say absolutely. Your warm up, for a horse that has not been injured and is maybe, young or middle aged, you can certainly I think a walk is probably a part of most people's warm up. You're starting on a long rein and then maybe taking up contact and then starting to do some suppling at the walk, those sorts of things. But yeah, if the horse has been injured, then they're going to have a very specific therapeutic exercise protocol, hopefully in combination with instructions from your veterinarian as far as what's acceptable or not acceptable. Sometimes if with an older horse, it might take longer of a warm up. You might need, 20 minutes of walking before their old joints are ready to break into a trot. So I think, yeah, it depends on the age. It depends on the injury. If there's some specific stiffness, say in a muscle from an old injury, scar tissue, those things again might take a little bit longer, slower warm up than maybe a horse that hasn't had that type of injury.
What are your recommendations to treat contracted tendons with arthritis?
I'll let Dr. Zellmer.
That's a whole at least 1 hour lecture for our vet students. It depends a little bit on the age of the horse. So that is going to be different between foals versus weanlings to yearlings, and then adults, so in foals, we most commonly most of us use some tetracycline injections to try to relax those tendons, combined with bandaging and possibly splinting, possibly even casting the legs to relax those tendons. Then in weanlings to yearlings, most commonly we do see contracted tendons that cause a clubfoot. And in those cases, we most commonly use therapeutic trimming and shoeing to try to gradually stretch out those tendons. I do try to use those with some phenylbutazone because they will be a little bit sore. That can have some negative side effects. We won't talk too much about those. And then if the contracted tendon is really severe, we do have some surgical options where we do perform, for example, what's called a distal check ligament desmotomy. So we cut one part of the deep digital flexor tendon. That sounds horrible if you're not familiar with it, but it is actually a very well tolerated procedure. And then we combine that with therapeutic shoeing, typically shoeing, not just trimming, to make sure that we get the most of the benefit from that surgery to relax and lengthen that tendon.
Other questions from the
Yeah.
room, or we've got one in the room?
What are your opinions on the use of sports boots on horses?
Yeah, so our opinions on the use of sports boots in horses. I think there's a variety of uses for sports boots. For preventing injury, I'm not always convinced that they actually prevent injury, but they can prevent brushing types of injuries, overreaching and that sort of thing. So yeah, as far as actually preventing a tendon tear, that's probably a different question that
Yeah.
Dr. Zellmer can answer her.
I have strong opinions on I used them, as you may have seen on the picture. My horse had some sports boots on at the beach. I sometimes feel that if you think about Most sports boots are made from relatively soft material, maybe some leather, maybe some plastic. And when a horse places its whole 1,000 pounds of weight onto that limb with that sport boot on that limb, those 1,000 pounds could just easily crush that sports boot. So based on that, I do not believe that sport boots really can prevent tendon injuries. But in the end, nobody 100% knows until somebody does a study on that. That would be interesting to do. They would need a lot of horses in that study.
Good question.
What are your thoughts on the wool line being actually causing damage to the doesn't get any better?
The question is whether wool lining heats up the tendons more. I guess I don't know of any studies looking at that, so I'm not sure that I don't know. I haven't heard one way or the other, to be honest.
Yeah. But we definitely also know that tendons heat up quite a bit under basically when they're being stressed. Actually, the inside of a tendon can heat up to, I think it was 108, 110 degrees Fahrenheit. Those cells in that area are also much more heat resistant, but still we do get most commonly damage in the tendon in the center of the tendon. So I do think it is certainly an interesting thought that keeping tendons warm may worsen that. On the other hand, when tissue is warm, it is more what's called extensible. So you can actually stretch it to a greater degree without damage than if tissues are cold. So there are lots of factors that will factor in there. That would be also a really interesting study to do. Let's see.
Again, from online.
Yeah, a couple questions online about hauling your horse after an injury to the vet, the recommendations for that, and I think we'll make that the final question, at least for this. You can stick around for a little bit outside. We're going to close the Zoom down after this. So hauling recommendations on kind of how to stabilize the injury.
Yeah, and I think certainly hauling your horse, if your horse is not good at trailering, could cause more injury. So properly, if it needs a bandage or even a splint, I guess having your veterinarian out to the farm might be important to make sure that the leg is properly stabilized, particularly for fractures. If we're hauling the horse to a referral center with a fracture, they need special care to make sure the limb is stabilized, because anything that causes the fracture to get worse can have a very bad prognosis for the horse. And some people will recommend facing the horse backwards in the trailer, depending on whether their front limb or their hind limb is fractured. Maybe less important for tendon type of injuries or joint injuries than fractures. But Dr. Zellmer,
I agree with Dr. Semevolos, especially if your horse has a fracture. Do not haul that horse in the trailer without a veterinarian having said, yes, you can haul that horse without a splint being placed onto that limb. And typically, we only want to transport them once the leg is appropriately stabilized for that trip, because it can be catastrophic if a piece of bone pokes through some skin. We typically then say it's twice the cost and half the prognosis.
looks like there's one question in the back room.
What do you suggest doing if you have to transport the horse because you're location wise, you can't get it out of that?
Yeah, and I guess it depends on, again, what type of injury we're dealing with. If it's if you're like a fracture, is that what you're asking? Well, I guess you do what you have to do then. Yeah, you do. If you can place a bandage like Dr. Zellmer showed, that's sort of a stack wrap, and you have those sort of supplies, and you've have the experience to do that, that would be better than if it's an injury that's maybe, if there's wounds over the leg itself. If it's an upper limb injury or wounds on the body, or, you know, say the hip area or something like that, then there's probably not anything you're gonna do prior to transport. And if there's a fracture, yeah, it'll be, I guess it's not the best case scenario, but if you don't have any other options, you do what you can.
I was just curious.
Yeah.
No, I mean, it's not always ideal circumstances, so.
And then I tell owners to drive so everyone honks behind them. Just, it's hard for the horses to balance themselves if you have to stop fast. I do think that's the time possibly that is the most dangerous for them. So the slower you drive, and the longer your braking distance, I think the easier it is going to be for them.